This account was initially made for occupational therapy students, but can be beneficial for anyone experiencing mental illness, anyone who loves someone with mental health issues, or anyone desiring to help others in such situations. Hi, my name is Valerie Swartz. I'm a huge football fan of the Miami Dolphins. Someone say that I'm obsessed. I have pretty much everything Dolphins. I have the clothes, I have the pennants, I have the stuffed animals, and even a life-size cutout of their quarterback, Dan Marino. I will watch a game yelling at the TV for bad calls, cheering excitedly when they score. I also have a baby at home. Let's stop. Like any proud mom, I have to show you his picture. This is my Solomon. He's a real mama's boy, but very friendly with others. Very unfriendly with others. Friends even call him the devil cat. Childhood. As a young child, I was living what many thought would be the American dream. My mom and dad were married. It was myself and one younger brother. We had a family dog, and we had a house in the country with a 2-car garage. This was a life I never imagined would be disrupted by mental illness. The National Alliance on Mental Illness reports that 1 in 4 American adults experience a mental health problem any given year, but I never thought I would be one of them. Mental illness runs in my family. On my mom's side, my grandmother and an aunt had been hospitalized for depression, and on my dad's side, I had an uncle who was hospitalized with a schizophrenic-type illness. But even though this happened in my family, it was something that we never talked about. It was covered up. My father was a mechanical engineer, having obtained a degree from a prestigious university. My mom had a high school diploma, and she stayed at home until I was in 5th grade when she returned to the workforce. We were very active in our local church. My father was involved in the leadership, and we attended basically every service that was held. I was a good student, getting mostly A's in school. Anything less was unacceptable. I was expected to follow my father's footsteps educationally and vocationally. I remember the only C I ever got. It was in, of all classes, gym class. We were doing gymnastics. I was so mad at myself that I vowed I would definitely get an A the following year. I worked daily on the gymnastic skills, and the next year achieved that A. I guess determination has always been one of my qualities, though I didn't always use it for good. School to me was a refuge and a safe haven from problems that were going on at home. I was often called the teacher's pet, and I had a major crush on my 7th grade homeroom teacher, so much that I quit choir that year because I didn't want to miss homeroom and seeing him. Throughout school years, I was involved in many activities. I was home pretty much to sleep, and that was it. I was involved in sports, such as softball and basketball. I was involved in the concert choir and the marching band, as well as 4-H and FHA. Looking back, there were signs of emotional problems at that time. I was a loner, shy, a perfectionist with a low self-esteem. I feared my father, and my mother was emotionally distant. Family members called me fat and ugly, and I always felt my brother was favored over me. At the time, people didn't see it as much of a problem. They figured that I would eventually just outgrow it all. And we had to maintain the image of the perfect family. My teenage years. In my teenage years, I felt a call to enter the full-time ministry. I became really close to my Lord and Savior Jesus Christ during that time. I remember sitting in church, longing to be the one preaching. That same quiet girl now wanted to speak publicly. I helped teach Sunday school classes and led a preteen youth group. I sang in the choir and even occasionally was given a chance to give a sermon. My parents, especially my father, opposed this ambition. He questioned how I would support myself on a minister's income. But at the same time, I was also involved in some unhealthy relationships with boys in my school. They became abusive relationships. Others had warned me against them, but I thought that I was a bad person, that nobody else would be interested in me. And I appeared to be an angel on the outside, but secretly I was very rebellious. In my mid-teen years, we began to experience family problems. My mom was working, and she started coming home later and later for work, until one night she didn't come home at all. My father would later tell my brother and I that she had moved in with another man, who had a son. This began a lengthy divorce battle that lasted several years between my parents. I felt abandoned by my mother, and I blamed myself, thinking I must be a bad person that she didn't want me around anymore. So I chose to live with my father. This was the beginning of some outward signs of mental illness in my life. Especially, I began to have an obsession with losing weight, even though at the time my weight was a very healthy one. I experienced a lot of sadness and confusion. Eventually, my parents tried to reconcile, but it failed. There was times I heard my dad drag my mom outside and lock her there, and I would lay frozen in bed, too scared to make any noise, hearing my mom screaming. Also during my teenage years, I had my first experience with counseling. The pastor of my church at the time came to me after one service, and she said to me that I just didn't see myself lately, that if I wanted to meet with her and talk, she would be available. At first I'd said no, but later I would go and approach her. But I was ashamed, and I lied about where I was when I had my appointments with her, and I would even go as far as to hide my car so that no one could see me at the church. But I also felt my problems were minor, that I should just be able to shake them off. But I continued meeting with my pastor until I left for college. In school, I received many awards for leadership, scholarship, and citizenship. I graduated with honors in the top 10 of my class and was chosen to give one of the high school graduation speeches. I also received a partial scholarship for college. On the outside, I appeared to have it all together, but inside I was falling apart. College years. I enrolled in a Christian college, majoring in Christian education and minoring in psychology. My goal was to get my bachelor's degree there and go on to seminary to become an ordained minister. I took on a full course load, pushing myself, wanting to graduate early. I became involved in just a few clubs and organizations, but mostly I felt isolated and out of place. My emotional problems worsened. I began to lose weight in unhealthy ways, determined to avoid the freshman 15. I became more depressed, sad, and lonely. I thought, though, that nobody would notice this. That is until one day I got a paperback from my one professor. On it he had written a note to me. He said that God had gifted me with so many abilities and talents. Why was I so shy and afraid to use them? Had something ever happened that caused that? That if I wanted, he was available to talk to. Well, I did eventually go and talk to him, but I basically brushed it off saying, that's just the way I am. But I eventually then sought counseling. After much deliberation, I remember walking back and forth in front of the office, but afraid to go in and admit I needed help. When I did finally admit this, I was assigned to an individual therapist, and I was also placed in an anger group. I questioned, why an anger group? I wasn't angry, I was sad and depressed. I felt lonely, but I would later be told that sometimes depression can be described as anger turned inward. In these sessions, I had little participation. I minimized my issues and my emotions and found it difficult to trust the people that I was supposed to. In spite of all the problems, I completed my freshman year, receiving Dean's List marks. I maintained my scholarship, and I was on track to graduate in 3 years instead of 4. That summer, I was offered a job through my church conference, where I would work at a day camp for children with special needs. I thought this would be a good opportunity to gain some ministry experience. Plus, it was a reason not to have to go home, because I would have to live on site at the camp. But I was nervous. I had never worked with anyone who had a disability before. But I found that as I tried and worked through this, that I enjoyed the position and the kids that I worked with. I worked there for 2 months during the summer and returned to school for my sophomore year. I continued to lose weight and felt even more depressed. I began to harm myself by cutting. Despite what people had recommended, I chose to move into a single dorm room, and my relationships with fellow students were difficult. I also had a wonderful work-study opportunity as an assistant to my faculty advisor. The sophomore year, I returned to the same counselor I had seen the year prior. I met with her a few times at the start of that new semester, but after about 3 weeks into the school year, I attempted suicide for the first time. When I talked with my counselor about this attempt, she had said to me that she could no longer handle it with just between her and myself, that I would either have to go home and try and work things out, or go to a local hospital for a psychiatric evaluation. I knew I didn't want to go home. That's where the problems were. So I chose the hospital. I was taken to the hospital and they decided to admit me on the psychiatric unit. I was started on an antidepressant medication and received my first mental health diagnosis of situational depression, which they attributed to the marital problems that were still going on in my family. Hospitalization. A few days later, I was transferred to a hospital closer to home, one that was covered by my father's insurance. Because of my situation, I was forced to withdraw from college, and that made me feel like even more of a failure. I thought that all my dreams were lost forever, and I believed I'd let myself and my family down. As a result of that, I was shut out by some family members and friends, people I thought who would always be there for me. And I had a conflict going on inside of me. I was questioning, can I really be a Christian and be mentally ill at the same time? I felt that God was punishing me, and I believed He could never forgive me, especially when I tried to take my own life. Some of the forms of treatment they used included group therapy, which was the most common, but I was very uncomfortable sharing with so many people around. I was also involved in family therapy sessions, which involved pretty much my mom, my dad, myself, and a therapist. But these were awkward and very stressful. And I thought, we're not really a family anymore, so what's the point of all this anyway? Also, while in the hospital, I received nutritional counseling, which I pretty much ignored. After being in the hospital for about 3 weeks, I was doing well enough to be discharged to the home of some family friends. But I wasn't there very long before I once again became suicidal and returned to the hospital after only 3 days. At that point, they talked of longer-term treatment. But first, they decided to try ECT, which is electroconvulsive shock therapy. Basically, they try and shock your brain into a seizure, which sometimes brings patients out of severe depression when other interventions have failed. But this was unsuccessful. I went through about 12 sessions of the ECT treatments to no avail and continued to go downhill. After about 3 months total, in a hospital where an average stay is only 3 to 5 days, I was sent to the state hospital. I was very afraid and heard many horror stories about what it was like to be there. I was only 19 years old when I was admitted. You had to be at least 18 at the time to be sent there. Shortly after arriving at the state facility, I was diagnosed with major depression, an eating disorder, and borderline personality disorder. I was also often called an attention seeker. They thought I was acting out just so people would notice me. But really, I just didn't know any other way to ask for help or to express my pain. At that point, I no longer felt like I cared about myself at all. I refused to eat. I neglected basic self-care and hygiene. My self-harm became more frequent and more severe, and I felt totally worthless. I felt like I wasn't even alive, but just existing in a shell of my former self. At the state hospital, there were various interventions that they tried. The one I liked the most was individual therapy. But I went through several therapists and psychologists until I found one that I could be comfortable with and open up to. I was also involved in educational groups that taught coping skills, which is basically how to handle the stressors of daily life. I also was in groups that talked about the mental illnesses and medications used to treat them. And I also had some time to learn about life skills such as budgeting and grocery shopping. I was also involved in what they called VAS, which is Vocational Adjustment Services. Through this, I learned computer skills and other things related to working, and also had the chance to earn a little money on the side. They also involved me in dietary and nutritional counseling there, where I learned to eat healthy and exercise properly. I had individual treatment team goals, which included refraining from self-harm and reaching and maintaining a healthy weight. And there were a couple women who came in as volunteers about once a week who did a Bible study with me. After being in the state hospital about 3.5 years, I had improved enough to start discharge preparation. I was started to be given passes with my father. I was given them when I was doing well enough to leave the hospital under his supervision. During these passes, I began attending a young adult program at a partial hospitalization. This was a highly structured program that resembles a hospital setting, but it meets about 6 hours a day for a few times a week. Though I was still having certain issues, I was discharged to live with my father a few days prior to Thanksgiving of 1999. But I totally disliked the partial program, and I did not actively participate. I would talk sometimes to my individual therapists, but shared very little during group time. Also, while attending there, I met another woman with an eating disorder. We became involved in a very unhealthy relationship where we fed off each other and we shared more techniques on how we lost weight. Also at that time, I threw out the medications that I had been taking because they were making me fat. After being out of the state hospital just a few weeks, I attempted suicide while at the day program. I was sent back to the community hospital, and after about 3 weeks there, sent back to the state facility. Back at the state, I had several more suicide attempts, a few that were very serious, and one I didn't almost make it through. I was self-harming on almost a daily basis. I felt completely hopeless. Many, including myself, thought I would never live successfully outside the hospital. Over the next 2.5 years, I was extremely self-destructive. At times, I became violent when staff tried to intervene and prevent me from harming myself. There were multiple interventions they tried, and it failed, both therapy types and medications. They didn't know what else to do to help. One common quote I was often heard saying was, "I'm living in hell anyway, I'm going to hell anyway, so I might as well go now." That was how desperate I felt at the time. Healing. After about 6.5 total years in the state facility, a combination of my 2 admissions, things gradually began to change for the better. At that time, I read a book by a popular Christian author. This book had actually been given to me years prior by a staff member at the hospital, but at the time she gave it to me, I wanted nothing to do with anything that had to do with God, because I felt that He was angry with me, and I was angry at Him for making me mentally ill. But I began to read the book, and as I read it, the author shared her experiences of abuse and how God had healed her. This enabled me to disclose my own secret past of emotional and sexual abuse. I thought if God healed her, He can certainly do the same for me. I remember crying and crying and crying. All I could say was, "It's real, it's real, it's real." But the initial panic led to a free release of painful memories. I was really hurt when some key people in my treatment told me that I made the abuse up and that I was psychotic. They didn't believe it really happened because I didn't reveal it sooner. However, I had previously brought up abuse in family and individual sessions, but I quickly silenced myself when it became too difficult to face and led to increased self-hatred. These accusations made by them led me to question my own sanity, and I felt re-victimized. But I spent about the next 6 months working on the abuse in individual and group sessions. I began to see a trauma therapist, and I questioned, what do I need to see a trauma therapist for? Millions of people go through abuse more severe than mine. It's no big deal. But with this therapist, I began to face the hurt, betrayal, and damage that resulted from my abuse. It had affected my life in many ways. This was the start of real positive change in my life. No more pretending, no more wearing the everything's okay mask. My primary diagnosis was changed to post-traumatic stress disorder. I stopped self-harming and reached a healthy weight. I was doing well enough that in December of 2002 I was able to be discharged. Just a few weeks prior to my discharge, I became an aunt to a beautiful little girl, and I wanted to be a positive role model for her. I became even more intent on working through my issues, not wanting to be hospitalized all the time, because I wanted to be actively involved in her life. I loved and continue to love being Aunt Valerie. It's been one of the best things in my life. As I mentioned, I was discharged on Christmas Eve of 2002. I moved into my own apartment, no longer on any psychiatric medications. There were very few people who believed this could happen, myself included. I firmly believed that my recovery was a miracle. It may have been impossible by man's standards, but I know that with God all things are possible. Altogether, I was in the state hospital for nearly 7 years of my life. And when I left there, I thought I would never again struggle mentally. But the transition from the hospital to my own apartment was harder than I anticipated. I had become attached to and overly dependent on a few staff members at the hospital. I also had been living for 7 years of my life in a highly structured environment, where there were always people around. Now I was living in my own apartment, having to make my own schedule. As a result of this difficult time, I had 3 admissions to short-term units over the next 3 months. They threatened to send me back to the state hospital. In order to help prevent this, I moved from my own apartment into a supervised apartment setting, with staff on site 24/7. During that time, I got a job at a training facility for adults with special needs, and this was a high personal accomplishment for me, because I really thought I would never be able to work a full-time job again. I also worked on feeling safe while being alone, and I did well enough that after about 8 months, this time feeling prepared, I moved into my own apartment. Then came what I call my 4 good years, where I lived like a normal person, whatever normal might be. I was off all medications, receiving no mental health services, and had a full-time job. During this time, I started attending a new church, one where I was accepted even with my mental health issues. At the church, they had a ministry training program, which I was accepted into and was able to begin working toward my minister's license again. During that time, I also coordinated and led a mental health outreach to people who have issues in their life. And I began a Bible study and participated in other volunteer events at the very state hospital I had been a patient at for so long. Relapse to recovery. After about 4 years of being out of the state hospital, I began again to feel overwhelmed and hopeless. I was involved in quite a few things, working full-time, delivering newspapers in the early morning, ministering to other people. I was busy all the time, and I became overwhelmed and once again felt depressed to the point where I attempted suicide. I was again admitted to a local hospital. I felt like a failure. I questioned my recovery, thinking, how could I screw this up again? I was never supposed to get sick again. The next years, up until now, I have had episodes of not doing well emotionally. I've had flare-ups of the eating disorder, and I've had suicidal thoughts and actions. I've had several short-term admissions and one brief stay at another state facility. But I've come to realize the true definition of recovery. It's not a one-time snap, fix it all, but it's an ongoing process of growth, of change, of learning that sometimes you have to live with the symptoms and they may never completely go away. I currently am involved in treatment for my mental illness. I see a psychiatrist to monitor my medications that I take for depression, anxiety, and to help with my thought processes. I also attend therapy on a weekly basis where I continue to work on my abuse issues, my eating disorder, and other issues that come up in my life. And I have a caseworker I meet with about once a week who coordinates these services and helps hold me accountable. My relationships continue to remain strained, but good things have happened in midst of these trying times. I remember a friend who also worked at the state hospital where I was at. He would constantly say to me, someday God's going to bring good out of this. Someday God's going to bring good out of this. I got so tired of hearing that, and I really didn't believe it. I just wanted to slap him. But good things did come out of it. In 2010, I became what is known as a certified peer specialist, which involved a 2-week intensive training that equipped me to walk alongside another person at an earlier point in their recovery, as together we work toward a goal that they have set for themselves. Also in May of 2001, I was granted my minister's license. I've had the opportunity to share my recovery story many times at local churches, special events, on the radio, and on the television show of the person whose book had really helped me so much. I now work part-time at our Social Rehabilitation Center, which is a place where people with mental health issues can come to be around others and to become involved in activities. I've taken some classes at a local community college and desire to complete my education and earn a degree that I have wanted for so long. Recently, I've become active in suicide awareness and prevention, and I have participated for the past few years in a drama troupe which seeks to educate people about mental health issues. Occupational therapy and mental health. Since this presentation is initially being made for OT students, I want to take a few moments to discuss the role of occupational therapy in my treatment and in mental health in general. When I was first approached by an occupational therapist, I didn't think it was any service that I really needed. I thought, isn't this more for people who require adaptive devices in order to work? And yes, OTs do this, but they also do so much more. I looked on the American Occupational Therapy Association's website, and it says, the overall goal of OT and community mental health is to help people develop the skills and obtain the supports necessary for independent, interdependent, productive living. Particular emphasis is given to interventions that result in improved quality of life and decreased hospitalization. When I was hospitalized, especially in the state facility, occupational therapy workers played a vital part of my treatment. They taught me coping skills, which is basically the mental health term for hobbies and interests that we use to occupy our time and keep focus on positives. One of these that I was introduced to while hospitalized was jewelry making. It was a craft, a way to divert my attention from the stressors that were going on. But it's something I really came to enjoy, and I continue to do it even today. And I've even had the opportunity to make a few dollars off of it because people have wanted to buy my pieces. Also, occupational therapy staff have helped to teach me life skills, abilities and knowledge to effectively live as independent as possible. I had lived much of my adult life in a psych hospital and needed to learn basic skills for my own daily living. For example, I was given a readiness evaluation in preparation for discharge. This included a financial section. At that time, I estimated that I could buy a month's worth of groceries for $24. Now, if anyone knows that, that's very unrealistic. But the OT had a group on shopping, where I was able to go shopping with the OT workers and realize more practical and realistic budgeting goals. They also taught me about healthy lifestyles, including proper diet and exercise. I was placed in a cooking group, and they also came and demonstrated exercise techniques to me. But by far, my favorite OT occupation was pet therapy. Even through my darkest times, my days would be brightened when they would bring the dogs into the hospital and we'd be able to pet and play with them. There are many other ways occupational therapy and occupational therapy assistants have helped, too many to mention here. I realized I may not require physical adaptive materials, but I needed mental adaptive techniques. Through occupational therapy, I've been equipped to live in mental health recovery and deal with everyday life, even when living with mental health symptoms. I've mentioned a few ways that occupational therapists have helped, but there's one more that I really need to address. No, I can't remember all the activities and the projects that they had helped me with, but one thing I will never forget is what many would not see as a typical occupational therapy intervention. I believe a good occupational therapy worker goes beyond teaching skills and treats those they help like an individual person. The people who work with me saw the me beyond the illness, beyond the times that were sometimes scary, beyond the uncertainty. They believed in and encouraged me, even when many others had given up on me. They showed me respect, even when I didn't respect myself. Though I rarely see any of the people involved in my treatment over the years, I recall the names and faces of most occupational therapists who worked with me. They taught me vital lessons that stick yet today as I go through daily life. Speaking specifically to future occupational therapy staff who are watching, I want to leave you with what I view as the most vital function of an occupational therapist or any mental health worker. See the person. Treat the person as an individual, not just another sick person. This, along with the skills, will make you effective and able to help even in the most hopeless of cases. In closing, for many years, I had lived with many labels that I received while dealing with mental illness. These began to block out the real me, and I lost my sense of identity to depression, post-traumatic stress disorder, confusion, eating disorder, anxiety, borderline personality disorder, and self-harm. Through the help of many mental health workers, friends, and most of all God, I've realized that I am not my illness. It's a part of who I am today. But so is being a friend, being a leader, being an aunt, a minister, a sister, an actress, and a singer. All of these, plus other things, make me the Valerie that I am today, and I'm no longer ashamed of who I am. No, it may not be the American dream I thought I would live as a young child, but I now have a new dream. This dream includes the desire to someday become a chaplain in a mental health facility. I desire to share the unconditional love of Christ that was shared with me. I desire to share the hope that's found in Christ that can't be found in any other source, and desire to use my experiences to encourage others in similar situations. I just want to say thank you for watching. Thank you to your instructor for asking me to do this, and I hope that you were touched by my story. I know that I was touched by having the opportunity to share it. I appreciate this opportunity and am thankful for it. Be blessed.